September 1960. The air in the Food and Drug Administration building in Washington, D.C. is thick with the smell of mimeograph ink, stale coffee, and the low, oppressive hum of fluorescent lights. This is the heart of American bureaucracy, a labyrinth of beige corridors and metal filing cabinets, a place where urgency is often measured in months, not minutes. For Dr. Frances Oldham Kelsey, just 1 month into her new job as a medical officer, this world is still foreign. Her background is in the dynamic, inquisitive world of university research, a place of hypotheses and peer-reviewed rigor. Here, the primary output seems to be paperwork. On her desk sits a particularly heavy file, its cover emblazoned with the confident logo of the William S. Merrill Company, a major American pharmaceutical firm. The application is for a new drug, Kevidon. Its generic name is Thalidomide. The file reads like a marketer's dream. Kevidon is positioned as a miracle sedative, a safe and gentle solution for anxiety, insomnia, and, most lucratively, for the nausea of morning sickness in pregnant women. Across Europe and Canada, it was already a blockbuster, sold over the counter in Germany as Contagon, hailed as a tranquilizer so safe you could give it to a baby. The company's application exudes this same breezy confidence. They expect a swift rubber stamp approval. Under the 1938 Food, Drug, and Cosmetic Act, the FDA had just 60 days to object to a new drug application. If the clock ran out without a formal rejection, the drug was automatically approved. The clock on Kevidon was ticking, and the pressure from Merrill was palpable from day one. They wanted it on American shelves before the Christmas rush. But Frances Kelsey was not a bureaucrat. She was a scientist, holding both a Ph.D. in pharmacology and an M.D. She possessed a deep, almost instinctual understanding of how chemical compounds behaved inside the complex ecosystem of the human body. As she sifted through the hundreds of pages, her practiced eye caught things a less trained reviewer might have missed. Her sharp mind immediately flagged inconsistencies. The application was heavy on soaring testimonials and anecdotal accounts, but astonishingly light on rigorous scientific data. The animal studies were flimsy, the results summarized in a way that felt more like a sales pitch than a scientific report. There was almost no information on how the drug was absorbed, metabolized, or excreted by the body. Most alarmingly, for a drug being aggressively marketed to pregnant women, there was a complete absence of data regarding its effects on a developing fetus. The company's logic was dangerously simple. Since the drug didn't seem to harm the mother, it was assumed to be harmless to the child. Kelsey knew this was a catastrophic assumption. Her doctoral research under the legendary pharmacologist Dr. E.M.K. Gailing had involved studying how substances cross the placental barrier. She knew that the placenta was not an impenetrable fortress, but a sieve. To claim a drug was safe for pregnancy without ever testing it on pregnant subjects was, to her, a profound breach of scientific ethics. Then she found another, more subtle clue buried in the medical literature. A small note, a letter to the editor in the Bataille, mentioned that some long-term users of thalidomide were reporting a painful side effect, peripheral neuritis, a type of nerve damage in the hands and feet. It was a detail Merrill's application conveniently omitted. This was a critical red flag. A drug that could damage mature, resilient nerve cells in an adult. What might a compound that powerful do to the rapidly forming, exquisitely vulnerable nervous system of an embryo? She did what any good scientist would do. She asked for more information. She sent a letter back to Merrill, formally placing the application on hold. She requested comprehensive data, chronic toxicity studies, metabolic pathways, and, most critically, evidence, not assumptions, of its safety during gestation. The company's response was not scientific. It was one of indignant fury. Their executives called her superiors, complaining about the delay. They dismissed her concerns as trivial, the peripheral neuritis as a rare anomaly. They portrayed her as an obstructionist, a pedantic bureaucrat standing in the way of progress. The pressure was immense, directed at a woman who was not only new to the job, but one of only a handful of female physicians at the FDA. The system was designed for swift approval, for a smooth pathway from corporate lab to public medicine cabinet. Her methodical, cautious approach was a wrench in the gears. Who was this rookie scientist, this lone woman in a sea of men, to question a pharmaceutical giant and its celebrated wonder drug? Following that initial red flag, Dr. Kelsey's quiet inquiry morphed into an outright battle. The 60-day clock had been reset, but the siege had just begun. For the next year, her small office at the FDA became the front line in a war of attrition. The William S. Merrill Company, incensed by the delay, escalated its campaign from indignant phone calls to a full-blown lobbying assault. They sent delegations of men in sharp suits, executives, lawyers, and hired gun doctors who would sit across from her desk, their polished shoes tapping impatiently on the linoleum floor. Their tone was a carefully calibrated mix of condescension and intimidation. They presented glossy brochures and testimonials from European doctors instead of the hard data she requested. They spoke of the millions of dollars in potential revenue being lost, the suffering patients being denied relief. In archived interviews, Kelsey later described the atmosphere of these meetings. They implied I was being overly cautious, difficult, and stubborn, she recalled, her voice retaining a clinical calmness even decades later. The subtext was clear. She was a woman being emotional, not a scientist being rigorous. They called her a nitpicker. One executive patronizingly told her superiors he hoped they could find a way to get her to be more reasonable. Yet, with every meeting, her resolve hardened. Her requests for data were not unreasonable, they were fundamental. She wanted to know if the drug built up in the body's tissues over time. She wanted to know if its chemical structure changed after being metabolized. And she repeatedly, insistently demanded teratology studies specifically designed to detect effects on fetal development. Merrill's response was a masterclass in corporate evasion. They sent back reams of irrelevant animal data, anecdotal reports, and legalistic arguments, but never the specific controlled studies she required. Internal FDA memos document her persistent rejections, each one a meticulously reasoned, scientifically grounded refusal to yield. She denied the application a total of 6 times. Each denial was an act of bureaucratic courage, pushing back against not only a powerful corporation, but also a pro-business institutional culture that viewed regulation as an obstacle to innovation. Her own supervisor, while supportive, was under enormous pressure to resolve the impasse. The unspoken threat to her career loomed constantly. While this lonely battle was being fought in a quiet Washington office, the tragedy was already unfolding across the globe. Thalidomide, under brand names like Contergan, Distaval, and Softenin, was being consumed by the millions. And a horrifying pattern was beginning to emerge. In Germany, pediatrician Wiedekind Lenz began noticing a sudden, inexplicable spike in infants born with phocomelia, a terrifying condition where hands and feet are attached to shortened or absent limbs resembling the flippers of a seal. In Australia, obstetrician William McBride made a similar, chilling observation among his own patients. They began to suspect a link to the popular new sedative their patients were taking for morning sickness. Whispers in medical journals became published papers. The evidence was anecdotal at first, but the numbers were growing at an alarming rate. Dr. Kelsey, an avid reader of international medical literature, was connecting these dots. She saw the reports from Lenz and McBride, and they confirmed her deepest fears. The nerve damage she had noted in adults was a pale shadow of the drug's devastating potential. It wasn't just a toxin, it was a teratogen, a substance that actively interfered with the fundamental blueprint of human development. Meanwhile, Merrill continued to deny any connection, dismissing the European reports as unsubstantiated. Worse, they had already distributed over 2.5 million thalidomide tablets to more than 1,200 American doctors as free samples for investigational use, a legal loophole that put the drug into the hands of an estimated 20,000 American patients, including hundreds of pregnant women. The poison was already inside the gates. Could one woman's unwavering caution truly hold back a global tide, or was she fighting a losing battle against a powerful system? That question, whether her stand was too late, was answered not in an FDA memo, but in a torrent of global headlines that ripped through the public consciousness in late 1961 and early 1962. The whispers from Europe had become a roar of anguish and horror. The story finally broke in America with devastating force, largely thanks to an investigative piece by reporter Morton Mintz. He had been tipped off to the story of a stubborn FDA reviewer holding back a dangerous drug. His article, published on July 15, 1962, detailed Kelsey's lonely, year-long battle and laid bare the unfolding catastrophe in Europe. The American public awoke to a terrifying realization. A generation of their children had been saved from a silent plague by the integrity of a single civil servant. The vindication was as swift as it was absolute. As the tragic news flooded in, Merrill, facing a tidal wave of public outrage and imminent congressional investigation, quietly withdrew its application for Kevidon. The congressional hearings, led by Senator Estes Kefauver, became a national spectacle. There, Dr. Kelsey's meticulous, methodical work was finally brought into the light. Her calm, factual testimony, backed by a mountain of correspondence and scientific reasoning, was unassailable. She wasn't a stubborn bureaucrat, she was a vigilant protector. The hearings laid bare the devastating truth. The drug caused phocomelia and other severe abnormalities. UNESCO reports and medical journals from around the world confirmed over 10,000 cases of severe birth defects and thousands more infant deaths. In the U.S., thanks to Kelsey, the number of confirmed cases was only 17, a tragedy for those families, but a fraction of the catastrophe that had been averted. The science that emerged from the tragedy was a chilling lesson in biochemistry. Thalidomide is a chiral molecule, meaning it exists in two forms that are mirror images of each other, like a left and right hand. These are called enantiomers. Scientists discovered that the negative enantiomer was indeed an effective sedative. But its mirror image, the positive enantiomer, was a catastrophic teratogen. It worked by inserting itself into cellular DNA, preventing the synthesis of proteins crucial for limb development, effectively switching off the genes for growing arms and legs at a critical stage of fetal development. Even more sinister, researchers found that the safe form could convert into the dangerous form within the human body. This explained everything. It proved why Kelsey's insistence on deep metabolic studies was not nitpicking. It was the single most important question to ask. Her courageous stand became a watershed moment. It was the catalyst for the most significant drug safety legislation in American history. In October 1962, a galvanized Congress passed the Kefauver-Harris Amendment. This law fundamentally transformed pharmaceutical regulation, mandating for the first time that manufacturers provide scientific proof of a drug's effectiveness and safety it could be marketed. It required informed consent from participants in clinical trials and gave the FDA true authority to regulate the industry. On August 7, 1962, in a ceremony at the White House, President John F. Kennedy awarded Frances Oldham Kelsey the President's Award for Distinguished Federal Civilian Service, the highest honor for a civilian. He praised her exceptional judgment in evaluating a new drug for safety for human use, which had prevented a great tragedy of birth deformities in the United States. This wasn't just a personal victory, it was a powerful public declaration that scientific integrity could and must prevail over commercial pressure. Her story forces us to ask, in today's world of accelerated approvals and immense corporate influence, who are the Frances Kelsey standing guard? And are we as a society listening?